Yep.
Hi, my name's Leesa, 186 12253, Leesa Heslop. I'm just going to be doing an administration of a S8 medication, oral. Just washing my hands. Okay, so I'm just reading the notes. We have Mr. Peter Pitt, 72-year-old man who presented to hospital post-trauma. He was in a pedestrian accident and he's got some injuries on the right-hand side of his ribs, abrasions and wound to the left leg. He's 72 hours post-admission, full primary survey's been attended, and he is for some oxycodone for pain relief. Okay, I also notice he's got a medication chart here, and he's also ordered, he's got the oxycodone, which is ordered, and I'll validate that in a moment, and he's also got some paracetamol. I'm just going to go and check with the patient. Okay. Hands. Okay. Oh, hi, Mr. Pitt. How are you?
I'm feeling a bit sore.
Oh, okay. Yeah, so you have been in a bit of an accident.
Yep, that's right.
Okay, oh, that's no good. My name's Leesa. I'm a student registered nurse, and I'm attending to you today. I'm just wondering, I've got some medication here for you. I'm just wondering if I could ask you a few questions and some details. Is that okay?
Yep.
What's your name?
Mr. Pitt.
Yeah. Get your first name,
Peter.
Peter. Yeah. And what's your date of birth?
It's it's the 1st of the 1st, 1945.
Are you allergic to anything?
Yes, I'm allergic to penicillin.
And what happens with that?
I get a rash.
Oh, okay. And I'm just going to check that against your armband.
Mm-hmm.
So it's Mr. Peter Pitt. Sorry to lean over. It's just your band is on the other side. Okay. 123754. Mr. Peter Pitt. Peter Pitt against the medication chart. Date of birth, 1st of the 1st, 1945, and I can see that you've got a red allergy band, which indicates to me that you do have an allergy, and you said that you are allergic to penicillin.
That's correct.
Okay, all right. So, Mr. Pitt, you said that you were in some pain. If 0 is the no pain and 10 is the worst pain, could you tell me what pain level you were in?
So it's around about an 8.
Around about an 8?
Yeah.
Okay. 8 out of 10, so that's quite a severe pain.
Mm-hmm.
Okay, so this oxycodone should be able to help with that. Could you tell me where the pain is?
It's down the left side.
Left side. Okay. All right. And down your left side on the leg. On the leg.
Yeah.
Okay. Yep. Said that on the leg. Okay. So I'll get you this medication. In the meantime, I do have to do a set of your vital signs. I can see that they were within range a little while ago, but what I'll do is I'll just do another set just to make sure that they are within range.
Yep.
This medication can cause a bit of respiratory depression. It can actually cause a bit of hypotension, which is low blood pressure, and it can cause you to feel a little bit dizzy and sometimes a little bit nauseous.
Yep.
So I like to make sure that your medication, that your observations are within a normal range before that we give that medication to you. I can see that they are within range, so I'd be happy to give that. I'm just going to go and get that checked. Here is your buzzer. If you need anything in the meantime, could you just let me know, and I'll be straight back. Otherwise, I'll be back in a few minutes with the medication.
No problem.
Okay.
Thank you.
Thank you. Okay. So I'm just going to validate the order, and am I able to get you to, I've got
Yep.
a second RN, am I able to get you to validate this order, please?
Mm-hmm.
Okay, so I have a Mr. Peter Pitt.
Mm-hmm.
I've just checked his ID band and just checked that with the patient.
Yep.
He's got a penicillin rash. So Peter Pitt, 1st of the 1st, 1945, Dr. Brown's ordered this medication. He's allergic to penicillin. It gives him a bit of a rash. That's been signed and dated by the doctor.
Yep.
The order is within date. There's a medication name. Oral, 7.5 milligram, twice a day. It's for pain. It's been signed by the doctor, and there's got a name there, and it's got a contact detail as well. So that's all the medication, 5 rights of medication, and it's also it has not been given for today.
Yep.
Okay, at 8. He's also ordered for some paracetamol, which I'm not going to be giving now, but there is some medication there that hasn't been given, but I'm just going to be giving the oxycodone today.
Yep.
Are you happy to validate that order for me?
Yes.
Okay, great. Well, with oxycodone, I'm just going to check the MIMS. Okay, so in the MIMS, it actually says that this drug is an opioid analgesic. It's for moderate to severe pain, and he is in a pain of about 8, which is quite severe. It can actually cause respiratory depression, arrhythmia and hypertension. The starting dose, 10 milligrams, and he's on 7.5, so that's within range. For oral, can cause a bit of GI upset, dry mouth and sedation and confusion as well, so I'll be monitoring for that. Monitoring all the vital signs. I've just done a set and they're actually fine, within range, signs for respiratory depression. Are you happy for that?
Yep.
Okay, so they're all within range and I'll be monitoring that every few minutes, every 15 minutes. Okay,
Yep.
Great. With
Yep.
me? Okay, so I've got the keys on me. Okay, so I'm just going to pop over to the medication cupboard. Okay. Squeezing in here, isn't it? Okay, so I've got the order for Mr. Peter Pitt for oxycodone. So I'm just going to be checking, the first thing I'm going to be doing is checking the S8 book just to make sure that the medication that's in the cupboard is what is stated in this book, the legal requirement, S8 drug book. Okay, so I've got the keys here. I'm just going to be grabbing that out of the cupboard. Lock in the cupboard. Cupboard's locked, and I've got the keys on there as well. Okay, so we have Endone, which is one sealed box. So Endone, oxycodone, the trade name's Endone. Expiry 2020. And you can see that's a sealed container, so that's 20.
Yep.
Okay, 20 in there. This one here is an Endone as well. It's oxycodone, expires 2020. This is not sealed, so I'm just going to tip that out and see what actually is in that. Okay. Okay. So there's 3 tablets. Endone, expiry 2020. So we have 23 tablets, sealed box, plus this one which is tipped into here, which is 23. Are you happy with that?
Yep.
Okay, great. All right, so I'm just going to do my first drug check. Are you happy to do the first drug check with me? Okay, so we have Peter Pitt, Mr. Peter Pitt. Date of birth 1st of the 1st, 1945, as checked with the patient. He's got a penicillin rash. It gives him a rash, penicillin. That's signed and dated by the doctor. We have oxycodone, 5th of the 3rd, 18, so it's in date, per oral, 7.5 BD for pain. It's signed by the doctor, it's dated, and it's got a contact detail, and it hasn't been given for today.
Yep.
Okay, I'm just going to check that against, that's the 20 sealed container, 2020, and oxycodone.
Yep.
That's 3, that's 23 there. Okay, and I'm just going to check that. We have oxycodone, sealed container, oxycodone, hydrochloride, 5 milligram, 2020, 5 milligram, 2020 against there, and that's the first check.
Yep.
Okay, all right. So now I'm just going to do a little bit of a drug calculation, because it is actually, it's going to work out to be 1.5 tablets, because this comes in 5 milligrams.
Yep.
So I'm going to have stock required over stock strength times volume over 1. So it's 7.5 milligram over 5 milligram, because I have 5 milligram here, and that equals 1.5 tablets. Are you happy with that?
Yep.
Okay. I'm just going to do my second drug check now. All right. So second drug check, that is the sealed container. Okay, oxycodone, 2020 sealed container, and that's oxycodone, sealed container, and that's 3 in there. I'm just going to check that against the order. So Peter Pitt, Mr. Peter Pitt, MRN 123754, date of birth 1st of the 1st, 1945. It's signed by the doctor. Penicillin, it gives him a rash, that's what he's allergic to. Penicillin gives him a rash, it's signed by the doctor, it's dated. So oxycodone, 5th of the 3rd, in date, it's got per oral, it's got a route, 7.5 milligram BD for pain, been signed by the doctor, signed by the prescriber, signed by the doctor, and it's actually got a contact detail, and it hasn't been given today.
Yep.
Okay, so oxycodone 2020. So that's my second check. So now I am going to be cutting that pill in half, because as per our calculation, stock required over stock strength is volume over 1 is 1.5 tablets. Okay? All right. Okay, so I have my little pill cutter here. So I'm going to be taking, so it's 1.5, so 1 there, okay, and a half here. I'm just going to be putting that in the centre and cutting that down the middle, okay, so that's 1.5. I'm going to be discarding that other half, okay,
yep.
Happy to see that?
Mm-hmm.
Okay, so that's in there, that's the other half, so 1.5. Okay, so I'm just going to now do my third drug check. Okay, so my third drug check, oxycodone is a sealed box, 2020, oxycodone, that's 20, that's oxycodone against the order, 7.5, 7.5, so that's 1.5 tablets as per here. 2020 is the expiry date.
Yep.
Signed and dated by the doctor. It's got a oral 7.5 BD pain, and it's all signed and hasn't been given today.
Yep.
You happy with that?
Yep.
All right. Okay, so that was my third drug check.
Mm-hmm.
Now I'm just going to make sure that I'm putting the correct amount back into the container,
yep.
as per the book. So we have oxycodone, 5 milligram 20, okay, and then this is the box that I'm going to be putting this one back into. So oxycodone, expiry 2020, 21 going back into the cupboard.
Yep.
Okay, and I'll put that back in the cupboard. I'm just going to fill this out. Okay, so that is 930, Peter Pitt, 1.5, and we're going to be discarding 0.5, and it's leaving a balance of 21 as just seen.
Yep.
P. Brown. Okay, here's the doctor, and I'm the administrating person, so that's me. Are you happy to sign that?
Yep.
Okay. Okay, and now I'm just going to be putting, locking this back up in the cupboard.
Yep.
Okay, and then we'll go and administer that to the patient. Okay, so as per the order, I'm putting this back in the cupboard along with the medication cup, the cutter. So I'm locking the cupboard, putting that back in, and also putting the cutter back in as well.
Mm-hmm.
And I have a medication cup. Cup. And have that on me at all times. And this book is actually going to be going back in the cupboard, and we'll take a photo of that at the moment as well. Okay. All right, washing hands. All right, they're
Yep.
happy to
Yep.
come with me to give this medication. Okay. Hello, Mr. Pitt. Hello. I'm back with your medication.
Yep.
Yeah, how are you feeling now?
Still sore and painful.
Yeah, this should help with that. I'm just making sure, and I'll be checking on you frequently,
Yep.
just to make sure. As I said, it can cause you a little bit of dizziness, can make you feel a little bit sick in the stomach, can cause a bit of hypertension, so low blood pressure. So I'm just going to be checking just to make sure that everything's okay with that. Can you just tell me your first name, please?
Peter.
And your last name?
Pitt.
And what's your date of birth?
1st of the 1st, 1945.
Are you allergic to anything?
Penicillin.
And what happens with that?
I get a rash.
Okay, I'm just going to check that against your armband. So Peter Pitt, 123754, 123754, 1st of the 1st, 1945, and you're wearing an allergy band, which means that indicates to me that you do have an allergy, which you said is penicillin.
Mm-hmm.
Okay, so I'm just going to sit you up a little bit, okay, and I'm just going to get you to take this. I do need to see that you have swallowed this medication.
Yep, thank
So
you.
here's some water.
Mhm.
Okay, so I just need, it's a requirement, I make sure that I see you have that medication.
Mhm.
Okay, and what I need to do now is I just need to be checking on you frequently. I'll come back in about 10-15 minutes and redo your vital signs, your blood pressure, respiratory rate, saturations, all of those vital signs, just to make sure that you are okay. And here is your buzzer. Do your heart rate as well. Here's your buzzer. If you need anything in the meantime, please buzz, and I will come back and see you straight away. Otherwise, I'll be back in a few minutes to check on you.
Yep.
Okay, so now what I need to do is here. So that's been disposed of. Okay, I'll dispose of the equipment. Medication cup has been disposed of. I was wondering if I get you to sign that I've given this medication.
Yeah, everyone that is
Given
just about the film, that's
So just blowing the time in there.
just try and keep it down for everyone else because we don't want it too loud in here, okay? Just give a heads up so you guys don't like interfere with each other.
Thank you. My hand. And that concludes the end of my S8 drug administration. Thank you.